Assalamualaikum warahmatullahi wabarakatuh. Thank you for inviting me to speak at this DAR International Alliance Conference 2023. I'm Professor Muhammad Yazid Jalaludin. Today, I'll be speaking to you on Ramadan fasting and diabetes in adolescents. During this talk, I will try to cover the prerequisite criteria for fasting for adolescents during Ramadan, looking at the challenges, especially on the education and blood glucose excursion, and then look into the management of fasting during this period of time, including the nutritional care and the insulin regimen. So, if we look at the International Society for Pediatric and Adolescent Diabetes Clinical Practice Consensus Guideline 2022, on the topic of Ramadan and other religious fasting by young people with diabetes that has just been published in October 2022, we can see that these guidelines tells us that Ramadan fasting is obligatory for all healthy adolescents and adults, but individuals with illnesses are exempted if they feel fasting is going to adversely affect their health. However, many individuals with diabetes choose to fast, including the adolescents. And those who are exempted from fasting include prepubertal children, as well as individuals with chronic illnesses in whom fasting may be detrimental to health. And in this group, type 1 diabetes mellitus children and adolescents is categorized as a very high risk. So now let us look at the criteria and challenges. As you can see from here, there is a great glycemic variability during Ramadan fasting in individuals with diabetes on your right side. As you can see there is a rapid rise of the blood sugar at around 7 p.m. with a reduction in the blood sugar just between 3 p.m. to about 7 p.m. as you can see in red, as compared to the healthy individuals on your left side. So, ISPEC again mentioned that the children and adolescents with diabetes actually may fast during Ramadan, provided they fulfill certain criteria such as reasonable glycemic control, good hypoglycemia awareness, as well as willing to frequently monitor their blood sugar during the fasting itself. And the International Diabetes Federation and Diabetes in Ramadan International Alliance 2021 has published practical guidelines. And these include looking at the risk stratification for persons with type 1 diabetes who wish to fast. And this include those who have pre-Ramadan good glucose control, and they are having the duration of type 1 diabetes for those who are basically in the newly diagnosed or within the honeymoon period. Those who are at a hypoglycemic risk also included into the risk stratification. Other risk stratification that they look at is the level of hypoglycemia awareness, level of diabetes-related education, motivation for self-monitoring of blood glucose, the ability to take appropriate decision-making, together with looking at the feasibility and access to continuous glucose monitoring and advanced insulin delivery technology. Other than that, the presence of diabetes-related complication and or associated autoimmune disorders such as celiac disease and thyroid disorder were also included into the risk stratification. Apart from that, they also look at the criteria for fasting. Those who have poor glycemic control or those with wide glucose fluctuation, the insulin regimen should be adjusted and re-evaluated before the start of fasting itself. And individuals with type 1 diabetes, regardless of their age, and their carers or guardians should be taught about the potential adverse effect during fasting, as well as appropriate preventative measures to minimize the risk of these from occurring. They also should look into the nutritional assessment, reviewing the carbohydrate intake, the carbohydrate counting, the recommendation about the proper food, as well as emphasis on the importance of a scheduled time for meals rather than following a looser, erratic, and frequent eating patterns, as well as looking at adequate intake of sugar-free beverages, especially with the pre-dawn meal. So a number of criteria has been put up by the IDF and the Diabetes in Ramadan International Alliance. These also include looking at the insulin regimen itself, by cutting down the basal insulin by about 10 to 30%, and an individualized regimen should be considered. Blood glucose testing should be done as frequent as they can, and this is fundamental to ensure early recognition of abnormal glucose readings. And the use of CGM as well as flash glucose monitoring is superior to the traditional blood glucose monitoring. And one thing that came out from the guidelines is that fasting should be broken immediately with hypoglycemia when the blood sugar is less than 4 millimole per liter in individuals using MDI, both symptomatic or asymptomatic. For those using the insulin pump, they can try to suspend the pump if glucose drops below 5 millimole per liter, but should also break the fast if glucose is less than 3.9 millimole per liter. So these are the things, the criteria that came out from these guidelines in 2021. In a narrative review by Besha and group that has been published in 2019, they actually look into the stumbling blocks in facilitating Ramadan fasting in type 1 diabetes patients. This include lack of proper pre-fast assessment management, as well as lack of diabetes education. And to ensure the safety of type 1 diabetes adolescent who wants to fast, the strategies that they have put up include Ramadan-focused medical education, pre-Ramadan medical assessment, following a healthy diet and physical activity pattern, modification in insulin regimen, as well as blood glucose monitoring as advised by the physician. So how to manage this group of children if they want to fast? Based on the IDF DAR criteria 2021, what is known is that fasting in adolescents and adults with type 1 diabetes carries a high risk. And we also know that insulin analogs are better than conventional natural protein hexagon insulin or the regular twice daily regimens. And we also know by now that insulin pumps are beneficial when fasting, and education is still not available to many people with type 1 diabetes. So what is new in 2021 guidelines? So there is, as I mentioned earlier, the risk stratification that is associated with fasting is not the same for all type 1 diabetes, adolescents or adults. And some people with type 1 diabetes may have a lower risk and can safely fast if certain needs are met. And fasting attitudes and outcomes vary considerably among different countries, as well as CGM can aid safe fasting, and augmented pumps have allowed individuals to fast for most, if not the whole month. So it is important to have a pre-Ramadan counseling, and this is actually being put up very strongly by the ISPAC Consensus 2022 guideline. Yeah, so the pre-Ramadan counseling should be given to children and adolescents who want to fast during Ramadan, and this includes giving them a review of their diabetes education. And this education should be directed to both the young person and his or her family by experts in this diabetes management. And what are the things that should be included? This should be a fasting-focused education, including nutrition, physical activity, insulin dose adjustment, and emergency management, looking as well at the hypoglycemia awareness, optimization of glycemia before fasting itself, frequent blood glucose monitoring, as well as learning how to interpret the readings and actions to be taken, as well as the requirement to immediately break fasting to treat hypoglycemia. And this is what we have been doing in our center since year 2020, where we have a nice talk to the patient as well as the parents just before, about 1 or 2 months before the Ramadan itself. So other guidelines, I mean, in 2021 guidelines, other thing that has been looked at is the nutritional care and the meal planning, basically looking at lowering the saturated fat and sugar intake by this adolescent during the iftar, and also looking at the pre-dawn meal that is should be eaten as close to dawn as possible, And lean protein and carbohydrate, low on the glycemic intake, low glycemic index should be used, and proper distribution of fluid intake during the non-fasting hours. And other nutritional care plan include the use of the intensive insulin therapy, and as well as discouraging continuous snacking overnight, as well as moderation in traditional sweet intake and fried food. So if we look at the insulin boluses and basal, this is the one thing that we encourage for children who wants to fast during Ramadan. And ISPAD 2022 have given us an idea on how to adjust the insulin doses at the different time points with the assistance of many or frequent blood glucose check. And as you can see here, this is the recommended insulin adjustment that has been put up by ISPAD 2022 guidelines. All right, and now I'm just going to show you some of the guidelines. Yeah, the guidelines coming from the 2021 by IDF and DAR on people who are using multiple daily insulin injection or the basal bolus regimen. As you can see from here, the basal insulin should be reduced by about 20 to 30% in those with HbA1c less than 7.5%. But for those with poor glycemic index, the basal insulin can be kept at the same dose. For prandial insulin, this should continue the same for iftar and sahur for those who have HbA1c less than 7.5%. And for those with HbA1c more than 7.5%, this should be reduced at sahur by about 20 to 30%. So there are some indications to reduce the insulin at the different timing of the day if one who use MDI to fast during the Ramadan. And for those who are using conventional regimens, this is actually discouraged, especially those who are on the twice daily insulin or those who are on premixed insulin, because of the risk of hypoglycemia and hyperglycemia, as we all very well informed about. All right, so as both from ISPAD and from the AR 2021 agree that basal insulin should be reduced by about 20 to 30% if it is given in the evening. And when taken at iftar, a further reduction may be needed up to about 40%. Bolus insulin for pre-iftar and pre-sahur should be equal to the pre-Ramadan lunch and dinner doses respectively. And for 2 daily injections and NPH, this is strongly discouraged to go on to fast during Ramadan. Premixed insulin is also not recommended in people with type 1 diabetes. What about those who are on insulin pump? Both ISPAD as well as DAR 2021 agree that those who are on insulin pump, they can continue to fast with a reduction of basal insulin of about 20 to 35% in the last 4 to 5 hours before iftar for basal insulin, and increase dose by about 10 to 30% after iftar up to midnight. For bolus insulin, prandial insulin bolus is calculated based on the usual ICR and insulin sensitivity factor. All right, so this is just to give you an idea of what I've mentioned earlier. Those who are on low glucose suspend or predictive low glucose suspend, this should be continued, and this actually can help to reduce the risk of hypoglycemia. And breaking the fast, for both ISPAD and DAR International Alliance agree that everyone should break the fast if the blood sugar is less than 3.9 millimole, or the blood sugar is more than 16.7, or there is symptoms of hypoglycemia or acute illness that occur during that time. So what is missing in this? There is a missing in terms of randomized clinical trials comparing different treatment regimen. There is a missing in impact of daily life on glycemic index, some missing data on risk score certification methods for adolescents, as well as missing research into the quality of life, as well as the peer pressure among adolescents who wants to fast during Ramadan. And some new data that came out from Bangladesh involving 74 children, they have shown that those children who has an HbA1c of more than 9%, these children can also fast quite safely, provided they have a proper education and intensive monitoring. Another paper coming from Kuwait tells us that children above 10 years old can fast during Ramadan, provided they have an intensive monitoring of fasting during the months. All right. So other than that, we also need to look at the medical legal recommendation, medical religious recommendation for fasting in adolescent. ISPAD recommend that the consensus guideline on the minimum age of fasting should be there. And there is a need to have a proper understanding of Islamic rules on fasting and sickness, as well as they need to have a liaison with religious scholars that should help to persuade those who do not qualify for fasting and avoid their feelings of guilt. And just a little bit on type 2 diabetes in adolescents. Basically, this group of children can fast during Ramadan, and most of them who are on metformin should have no dose changes that should be done during Ramadan fasting. So for type 2 diabetes as well, they need to have a regular and more frequent monitoring of blood glucose, even though if they are not on insulin. So ladies and gentlemen, in conclusion, type 1 diabetes is a chronic disease that requires a lifelong administration of insulin, and a good number of children and adolescents with type 1 diabetes fast during Ramadan despite being in the high-risk group. And hypoglycemia unawareness, and hyperglycemia are the major limiting factor in the management of type 1 diabetes during Ramadan. And pre-Ramadan counseling and education on insulin type and action, glucose monitoring, nutrition, physical activity, sick day and hyperglycemia, and recognition and treatment of hypoglycemia is a prerequisite criteria before allowing the child to fast during Ramadan. And as I mentioned earlier, conventional regimen is discouraged in individuals with type 1 diabetes who wants to fast during Ramadan. And all children who should break the fast is if the blood glucose is less than 3.9 or more than 16.7, or if they have symptomatic hypoglycemia. That's all from me. Thank you very much for listening, and I'm happy to take any question. Thank you.